Hi everyone, I'm Dr. Roman and I'm a blood and cancer doctor, and I'd like to talk to you about transfusions and ways or steps you can take to try to avoid them. So first of all, usually on the outpatient, meaning when you're not in the hospital, you start to develop anemia, and if they do not detect or if we don't find the reason for your anemia, yes, you may eventually require a blood transfusion. So the first thing you can do if you know you have anemia is take steps to try to improve your hemoglobin level. So the first question is, why do you have anemia? Do you have iron deficiency or B12 or folic acid deficiency? Or are you bleeding? Or do you have a malabsorption issue? Are you just not absorbing nutrients? Are you having hemolysis? That's when your immune system, there are many different types of hemolysis, but the more common type is when your immune system is killing off your red blood cells. Do you have a bone marrow failure, meaning that your bone marrow, what makes your blood, is simply not making blood appropriately? Needless to say, there are many different types of anemia. So the first thing you have to do is get blood tests done. And if you do have anemia, see your physician and take appropriate steps to improve your hemoglobin levels so you do not get to these transfusion levels. Now, the transfusion triggers, or the levels at which we tend to transfuse, is 7 grams. So once your hemoglobin level is below 7, that's when we start to request a blood transfusion. Now, obviously, if you're bleeding, or if you're symptomatic with a higher hemoglobin level, for example, if you just had a heart attack and your hemoglobin level is, say, at 8, then you may require a blood transfusion. So don't just think that your hemoglobin level is above 7, you're fine, you don't need anything else done. No, that may not be the case, and this is why you have to speak to your physician about your particular case. But knowing these transfusion numbers, usually when I'm asked or I get called to see a patient for significant anemia is in the inpatient setting. So this is when I see a patient in the hospital and their hemoglobin level is so low that they want a hematologist to intervene and to give recommendations. So the first thing is, when you're in the hospital, is why do you have anemia? Again, the same steps as the outpatient setting, meaning when you're home, we will take on the inpatient setting. Are you deficient in B12 or folic acid or iron, or are you bleeding, or do you have kidney disease? Do you have, whatever the case may be, we try to address it. So I will evaluate your blood, B12 levels, folic acid, your ferritin. That's the best way to check for your iron levels in your blood, is your ferritin level. And if any of these are low, then I will replace your levels. So the B12, I'll usually give it sub-Q or IM. You can also give it oral. The folic acid, I'll usually give it oral. And if the patient is unable to tolerate orally, then you can give it parenterally or by a shot. And if the iron level cannot be taken orally, then we will give it to the patient intravenously. Just know that oral takes a long time. If the patient's in the hospital, I will usually go ahead and give iron intravenously. Now, just know that there is a very small risk of potential infusion reactions, like an allergic type reaction. So just something you need to keep in mind. But overall, these are rare, and I have found that the benefit of iron, especially if your iron is low or on the lower end of normal, the benefit is much higher than the potential risk. Now, the next question is, and I can tell you this from experience, that us doctors tend to send an awful lot of lab tests when a patient is in the hospital. So every single time they're gonna come do blood tests on a patient or on you or on a family member, always ask, is this blood test absolutely necessary? Because remember, a lot of times it's 1, 2, 3, 4 blood tests, sometimes all in one day, not to mention blood cultures. This is when we want to make sure you don't have a bacterial infection in your blood. And when you put all these blood tests together, it really does add up. So always ask if all these blood tests are necessary. I know I've been in the hospital before, and every single time they're going to give me that little needle stick, I ask, why is this being done? And is it absolutely necessary? It's actually saved me from a few pokes. The second question is, do they have pediatric tubes? Sometimes they do, sometimes they don't, but a pediatric tube is simply a smaller blood tube, the one they use on children. So if they're able to do a blood test on you on a pediatric tube and take a little bit less blood, why not? But again, sometimes they have it, sometimes they do not. Now, the next step is, what I tend to do, together with the blood test, the B12, the folic acid, and the ferritin level that we spoke about previously, I want to make sure that you are not hemolyzing. That is when your red blood cells are being destroyed, usually by your immune system. Now, what I tend to do is send some blood tests, which are called an LDH, or lactate dehydrogenase, a haptoglobin level, and the direct Coombs test. So if your LDH is high and your haptoglobin level is low, that's highly suggestive that you might be hemolyzing. And if your direct Coombs test is positive, it usually means that your immune system is the one that's killing off your red blood cells. So again, if you are hemolyzing, we'll try to find why you're hemolyzing, and then we'll give you treatment for that hemolysis. Again, this is very rare, but I have found an occasional case here and there, and I've been able to dramatically improve the patient's hemoglobin level and, yes, avoid a blood transfusion. Now, the next thing is, are they having a bleed? Are they having hematuria, which means blood in the urine? Are they having a GI bleed? So, of course, it's common sense. If you're bleeding, your hemoglobin level will decrease, and we have to try to take steps into try to prevent you from bleeding or correct this bleeding so that it ceases. And if it stops, your hemoglobin level will improve. In the bleeding issue, we also have to consider, are you taking blood thinners? Are you on antiplatelet agents like aspirin? And if you are and you're bleeding, can we safely stop these medications? Now, sometimes you might be bleeding, but you need to stay on the blood thinner for other reasons. For example, maybe you had a heart stent put in, a cardiac cath with a stent because of a heart attack. And in those cases, sometimes we cannot stop the aspirin or the blood thinner, and it becomes quite challenging. But again, if you're bleeding, we need to take steps to try to lessen or stop that bleeding. Now, the kidneys produce a substance or a hormone that's called erythropoietin. Now, when your kidneys are bad, or you're on dialysis, or you have kidney disease, a lot of times the erythropoietin level in your body goes down. Now, erythropoietin is a hormone that stimulates your bone marrow to make blood. And if your kidneys are not producing enough erythropoietin, which we can measure your erythropoietin level, by the way, but if we think that your erythropoietin level is low, or if we measure it in your blood and it is low, then we can give you exogenous erythropoietin or EPO treatments. There's many different formulations out there, but just know that this is a medication that we can give you that can help your body make blood. Now, yes, this usually does help, but remember, this takes time. So don't think that we're going to give you this medication today and your hemoglobin will miraculously increase the next day. Okay, this is something that takes time. But if you notice that your hemoglobin, for example, you have a patient where their hemoglobin level is 11, then slowly down to 10, and then the next day it may be down to 9, and you see the trend that every day the hemoglobin level is going down, this is a good time to give erythropoietin. Now, erythropoietin does have some rare but potential side effects, very rare, small risk of potential blood clots, small risk of high blood pressure. So again, it does carry some small potential risk, very rare, but that's where you and your physician have to decide between the risk-benefit ratio and is it worth giving you this medication. Now, the other thing is, we spoke about your body making blood. If your bone marrow is abnormal, let's say you have a condition that's called a myelodysplastic syndrome, that simply means that your bone marrow is diseased and it's not making blood the way that it should. Or you have an aplastic anemia. This is another bone marrow disorder. There's many of them out there, but if your bone marrow is not making blood appropriately, then this will also decrease your blood levels. A lot of times when your bone marrow is not functioning, then your white blood cell count or your platelet count will also decrease. These are all components of your blood. But if you do notice that not only your red cells, but other cells, like I already mentioned, the white cells, the platelets are also low, then you may consider a bone marrow failure, or there's a problem with your bone marrow, and you may require a bone marrow biopsy or aspirate. So again, this is, a lot of information I'm throwing at you. As a small recap, always ask, are these blood tests necessary? Number two, do they have a pediatric tube, or a PD tube as we like to call it? Again, a lot of times the hospitals will not carry it. Sometimes they do, so ask. You're not going to lose anything by asking. Number three, how's your B12, your folic acid, and your ferritin level? Remember, that's the check for iron level. Are you hemolyzing? So I'll check an LDH, haptoglobin, and a direct Coombs test. Ask about erythropoietin therapy. Are you a candidate? And I found that a lot of times by taking these steps, we have potentially prevented a patient from requiring a blood transfusion or improved their hemoglobin level. Now, as just the end here, the conclusion, just know that I am not your doctor. I don't know your particular case, and I can tell you that every single case is unique. So listen to your doctor, ask the appropriate questions, and remember that every case is different. So there are occasions where a blood transfusion is absolutely necessary to maintain life or to prevent some type of catastrophic event, like for example, a heart attack or a stroke. So I hope you found this video informative. I make these videos, and I've said this on other videos, I make these videos on my own time. I am a practicing physician. I'm seeing patients all day long. So I come home, I'm tired. I'm going to give you this video with, none of the fancy editing or pictures. I'm giving you the information that you need. So I really hope that you find this informative, and my goal here is to help people out. And I found that this is something that's very useful, especially for the Jehovah's Witness community. I know I've helped a lot of Jehovah's Witnesses from when I see them in the hospital, because these are important steps that we can take to try to prevent our patients from requiring blood transfusions. Because although overall they tend to be pretty safe, but blood transfusions do have their potential side effects. So I only transfuse blood if I have to. If we can take steps to prevent this, absolutely, that is what we need to do, because I know I would not want a blood transfusion unless I really, really needed one. So thank you very much. Subscribe if you like it, and please leave some comments below, and I will try to answer your questions. Thank you.